Welcome to the Beyond Beauty Podcast with Dr. Corey Geiser and Dr. Troy Pearce. We're going to take you behind the scenes of cosmetic surgery and cosmetic dentistry. So y'all have that's actually a good topic. Y'all have a daily morning huddle, or do y'all call it a huddle?
No, because it's just us. Mm-hmm. So I think we're small enough. I like that concept, and I think once we're big enough that you won't see all moving entities, then making sure everybody's on the same page is really important.
When we were, let's see, I think we probably had 3 doctors. Maybe this is before we moved to our new building. I kept hearing people were doing these morning huddles, like trying to get your team kind of rallied in the morning and all that. And I was like, well, we have too many doctors here to do that. Would be too much stuff to talk about. I mean, I literally could barely keep my head around my own schedule, let alone someone else's who was it was an absolute zoo. So right. Now I'm like, I mean, we have a huddle every day, and it's maybe 10 minutes. And when I'm there, it's probably 10 or 15 minutes. And when I'm not there, it's probably 5 minutes.
Is that the whole team?
The whole team, minus we keep one person at the front to check people in, and they rotate back. I like to go through, I like to see, like, if anybody's sick today, like someone's not supposed to be here, do we have to make up for what the assignments are for doctors and assistants? And then I like for anybody to say, hey, this person that's coming in today, this person, like if there's some kind of special circumstance, maybe it's a person who was referred by somebody that was like a significant referral, or like something like a story behind it. And I always try to I always try to tell like war stories from the day before, like what we learned yesterday.
Oh yeah,
this is just this situation where we had this, and what did someone do well yesterday? I was really proud of how they handled that financing for that person and got them into treatment. So I got a big compliment on the front desk or something like that, just to kind of like, I don't know. I feel like talking, and a lot of people are like, okay, here's our daily goal. Here's what we're scheduled. And so if we do this much more, we hit our daily goal. And like, I don't like to think about that. Like, I have goals for everybody, but I don't like to have the meeting revolve around what we're doing in terms of a number, because it doesn't motivate people. It doesn't motivate people. Oh, well, if we do this, then everybody gets their bonus or whatever. I'm like, I don't really think that motivates this generation of people like it might have used to, maybe even 5 years ago.
This is the generation of people that still want a personalized thank you card for showing up to work with their paycheck. Paychecks aren't good enough anymore. The fact that I'm going to pay you to come into work is no longer good enough.
No.
Now you have to have your safety zone, your secure area, my blankie, my binky, and a personalized thank you every day for coming in and doing your job. And you're paying them top dollar. That's the thing, is these people are making more historically than ever before.
Yeah. It's you have to understand, I think, like what motivates. And it's hard to say a blanket statement for a whole generation, but it's almost the fact, like, it's almost a fact. I think that they much more value a compliment, a pat on the back, recognition amongst the team.
Yeah.
Everything's just about like, they want to be recognized for the work that they do, and they want others to appreciate them. Mainly, I think they want other people to appreciate them. And when they feel like we as leaders don't appreciate them, that is not good. That is not. I always hear that when someone comes from another office, like, well, what happened over there? I just never feel like she listened to us.
Yeah.
I don't think she appreciated us being there.
I feel like this generation wants to be congratulated on the work they were supposed to do.
Mm-hmm.
Like, well, I was going to do that and you didn't thank me for it, therefore I didn't do it. Like, well, you didn't do it. Why would I thank you?
Right.
That's why I didn't do it, because you didn't thank me. That's been
it's a challenge. There's no doubt about it. I've put so much focus lately on helping people understand that there's so much work that goes into getting a person in the office, getting them in the chair, agreeing to the examination, and then telling them there needs to be treatment. And that's like, full count, games on the line, bases are loaded. How do we perform right then? And I don't think people understand how important that moment really is. It's the job, and it's so repetitive to people. But I'm like, you're telling someone they need to spend $500 here. You're telling someone they need to spend $10,000 here. And if they don't say yes, it's going to cost them twice as much next year, potentially, or more. If they wait 5 years, it might, who knows how much it'd be. And so I'm like, you're really doing them a favor by getting them enrolled today. So I don't think everybody can appreciate that, because they're not in their shoes. They don't understand how bad that tooth hurts or how much damage is going to happen. And in cosmetics, it's not the same. But that's not there.
Right.
What you do and what I do, I'm like, okay, it's hard enough to get someone to say yes to something that requires them to take time off work, that requires them to pay for parking, to get a shot or two, and then have to deal with post-operative inflammation and sensitivities potentially. And and then again, you're like, okay, so if you don't do it, it's going to like be twice as bad next year or whatever. So cosmetics is, there's none of that's there. If you don't do it, you're still going to be just fine.
Have you noticed a trend, and this isn't everybody obviously, but where your maybe your general patient is more willing to undergo an aesthetics or cosmetic procedure, but has a harder time paying for their routine care that's going to save them thousands in the long run, but they'd rather spend a bunch of money to do something that's maybe not as important health-wise, maybe more important mentally to them, but maybe not health-wise. We have patients that won't pay their copay. When I used to do insurance, wouldn't pay their copay, argue about copays, but then would come in at a separate time and pay $6,000 for liposuction.
Yep. I've had patients that I'm like, okay, so we got our veneers all done. When's your next cleaning due? Oh, I actually go to this dentist down the street because he takes Medicaid.
Yes. Yep.
I'm like, well, people will pay for what they want.
Yeah.
Not necessarily what they need.
So on the topic of veneers, can we talk about some veneers today?
Yeah. So today we're gonna, like, I wanted to spit out maybe 3 or 4 commonly asked questions, or the way people come into the office thinking veneers, because that's just what they hear. But so I think one of the problems that a lot of dentists struggle with is that there's a lot of marketing that's out in the world now. It started with Invisalign, called direct to consumer marketing. And you see this with medications. I've always wondered, why would AstraZeneca advertise for a medication when these people can't actually go to the store and buy it?
Right.
That makes no sense.
Well,
I mean, in other countries, that's not legal. What's that?
They'll self-diagnose and they'll come in and ask for it by name.
Right. So Invisalign shows these beautiful smiles on TV or on social media, and people think, well, that's what I want, is I want a beautiful smile. So they go to the doctor, and a lot of times they'll go to an orthodontist. This is back 20 years ago when this started happening. And then the orthodontists were like, well, now general dentists are doing Invisalign because, people come into their office and anybody can do it. They didn't like that. Whoops. Now there's Smile Direct Club. Now you don't even have to go to the dentist at all.
Oh, yeah.
So you can just mix this stuff up at home. I mean, I honestly, I bet you if we have 20 assistants, I bet 75% of them could not take that putty and mix it perfectly and get a good impression. And they that's their job. So you get a patient to do it one time ever.
Yeah. But now we're sending it home with them through the mail.
Yeah. So you do that. You come back, you get these things that don't really fit. They don't really work. You pay $2,000. It's half the cost of Invisalign or maybe a third the cost of Invisalign at an orthodontist. And then they come to me and they're like, this stuff, it doesn't work. I did it and I still don't like my teeth. I'm like, well, it's because it wasn't the position of the teeth you're really worried about. It's because they're all got cavities in them and they're yellow or they're broken in half. You got infection. I think veneers are very similar. People hear veneers and they think that that's what they want. And so when someone comes in, I don't care what it is. They come in, they say, I need a root canal. That doesn't work. Like, let's diagnose you. So we have an exam. And our exam is the same for every patient. No matter what you come in saying that you have a problem with, we always have a consistent database of what we take. So we have a very visual exam that shows the patient what's going on. They can see it. They can see what I see. So it's not me telling them, okay, you have some wear on your teeth. Well, here it is. It's right in front of you. Here's your photos. Here's your scan of your teeth. Here's what it looked like if you had Invisalign actually done. So we do this exam and I'm like, so tell me what you see when we look at this picture of your smile. And they're like, well, they're not as, my teeth used to be a lot wider. They're almost see-through. I don't show many teeth when I smile. I'm like, so it's not the position of the teeth. They come and ask me, it's not the position of the teeth. It's the shape of the teeth. It's not that your teeth are, if we did some, they're not in proper position. So if we did some Invisalign, we could get them to be in proper position and then you might like your smile. So it's always about pumping the brakes, I say. Mm-hmm. And then saying, hey, let's see what is our number one goal is to provide the most conservative approach, the least amount of services to get the desired result. So let's see what you see about your smile. Let's see what we can offer and try to pick something that's the most conservative. And sometimes Invisalign is it, sometimes whitening is it. But when someone doesn't like the shape of their teeth or the color of their teeth, then it's probably going to be something like veneers. And veneers are just a facing on your teeth, not anything that's going to just, it's not. So veneers are made when the teeth are in the perfect position.
Well, let me go back real quick because I think you made a very important point for people to understand. Is you evaluate the patient, you diagnose, you formulate a treatment plan based on what is important to do for the patient, not what is important to do financially for you.
Right.
So if it's a simple whitening that's going to get the patient there, it's really important because a lot of people don't do that. A lot of people, hey, I want to jump to the most extreme, expensive thing that I can get you to do because you came in thinking you're going to spend money. That's what we're going to do. I see that all too often, across the board is just people. So it's really important that you do that. You take the time to evaluate the patient and treat them appropriately. But so you were telling me about the veneers and how they're
So orthodontics or Invisalign is a way that you can put your teeth in a position to have longevity where they don't wear down. If teeth are not in the proper position, then veneers won't work. So you got to make sure that everything is in functionally a proper position. You don't want to do cosmetic dentistry when there are underlying risk factors, we call it. We have to identify the risk factors. Are the gums healthy? Is there a decay issue? Home care? When all of those boxes are checked, then someone is a candidate for Invisalign. Or I'm sorry, for veneers. So I'll tell someone, like I just finished a case a couple of weeks ago. A lady came from Michigan, and her friend had gotten veneers. And when she came, she's like, I want veneers. And I was like, well, if we do veneers, there's gonna be a lot of risk associated with it, and we're gonna have to drill on the teeth. And I don't want to drill on teeth. So how about this? How about we do some Invisalign to put you in a better functional position, whiten your teeth along the way, and come back in 6 months. Invisalign only took 6 months for her. And I said, let's redo our records exam after the orthodontics is complete. And then you're at a point where things aren't breaking down at a more like accelerated rate.
Right.
And you're going to be in the best position to keep your teeth healthy for the long time. And let's see what it looks like. You might be really happy with that natural upgrade with Invisalign. And she came back, and it was like I hadn't seen her for 6 months. She's driving in and out of town when she comes for treatment. And I was like so surprised by just how well she did without any checkups for 6 months, and got her Invisalign. She goes, no, my teeth are still really small. I don't like the color of them. Invisalign worked great, but I'm ready to do veneers. Now she could be ready to do it now, but she could be in a position where she could wait years, and she knows that things aren't going to deteriorate because she's got everything in a healthy position. But she went ahead and wanted to do the veneers. And now that she was in a better functional position where her teeth aren't damaging each other just by chewing, we were able to do what's called no preparation veneers, where you don't have to do any drilling on teeth. And that was actually my number 2 question. Number 1 question was, who's a candidate? Am I a candidate? Number 2 is, I don't want to have to drill on my teeth and have them down to stumps, because
that's exactly what I think about when I hear veneers.
Right.
Little chiclet teeth.
Yeah, there's like tons of videos like that online, right? You see that, and it's like a horror story. People have these little fangs everywhere. So that's not veneers. Veneers are just a facing. I tell people it's like an analogy of like doing your kitchen cabinets.
Okay.
And you go into a home that's 25 years, 30 years old, and you don't like the color of the cabinet, solid wood, you'd hate to destroy them. So you redo the doors and like the drawers in the cabinets and put new hardware on them, and they look like brand new. That's what veneers are. It's not redoing your kitchen. It's just putting a new face and like a smile lift type of thing.
So it goes right over my current teeth.
It goes over your current teeth. So when we take a tooth and we just put a veneer on it without doing any alteration, you're going to be adding material and adding volume to the teeth. And that gives them more pop and a little bit extra length, a little bit extra volume in their smile. Some people want that. Some people don't want that. They're like, I don't want my teeth to be bulky. So when I hear that, I'm hearing that they don't want extra volume. They just want to change maybe the shape a little bit, but keep it in the same, what I call the same plane.
Okay.
We have to do some alteration to the teeth. And the alteration is usually taking out small amounts of decay that could be there, or even bigger cavities. Sometimes we can take out when we do that. Chips in enamel, some discoloration that kind of gets into the surface of the stain of the tooth. And it's about like a fingernail, maybe a 0.5 millimeter to 1 millimeter.
Okay.
Like taking a fingernail off and then adding it back, but you get to draw it back however you want to design it. If you say, I want white teeth, or I want natural teeth, I want teeth that are like really bright, or I want teeth that kind of have like a change in color from the top to the bottom and be really natural. Some people want a really natural smile. Some people want something that when they walk in, they go, ping, and it's just,
right? I want to blind everybody.
Like Ross on Friends.
Yes.
So they don't, they might not know what they want. So they might not know what type of smile they're looking for. They just know that when they see veneers, they recognize them because they weren't done properly. They're too bulky. They're too wide. They don't look real. They don't have the contours. So they're always like, well, I don't want them to look fake. And that was the number 3 question is, well, I don't want them to look artificial. I don't want anybody to know. So after all this exam, I'm talking to the patient and I'm like, okay, so now we know how many teeth we have to work on.
But you don't do all the teeth.
Sometimes we just do 2. Sometimes we do 4. I tend to do most of the time I'm doing 4 or 8. And people think if you're going to veneer your teeth, you veneer the front teeth. And technically the front teeth are canine to canine, but that makes it it's very rare that I do canine to canine because it almost seems to stand out more. So I try to stay within the canines or go behind the canines of tooth. And so, I mean, it depends on what we call smile display, how much smile or how much teeth do you show when you smile. So we take all of these different images and videos of you speaking and smiling, and then we kind of watch them together. And I'm like, all right, stop the video. Let's look at that picture there and see how many teeth you show when you smile. And that was just a conversation. Well, what happens when you really retract and you go and smile big, you know? So we're looking at that and I'm like, okay, so now we know how many teeth are involved. What do you want them to look like? Let's pick out things that we like in your smile. So I might pick out where the gum line is, and the gum line could be all even, or it might be high on one tooth and low on another. So we pick out parameters that we like, and that's what we use as a foundation to build the smile. So, all right, so see where that gum is. You think we kind of show too much gum over here. So over here, that's where the gum is just right. So let's let that be our baseline for the gum. Now let's look at the edge of the teeth, like the chewing surface. I'm like, all right, so we don't want it to hit your lip. This one's a little short. This one's just right. So let's let that tooth be the baseline for where we want the length to be. We pick out things that we like, the color, the form of the teeth, because they could all be different shapes and wear patterns and things like that. So once we have like a list, and then we're like, okay, so what about the color? And we look at color, not just by what color we pick, but the saturation of that color of white. And usually we're picking between 3 shades. I tell people there's like 25 different colors on this shade guide, we call it. But these are the 3 that I pick from 99% of the time. Natural, white, and bleach white. And then I show them cases. All right, that's what here's your skin tone. Here's a patient that has your skin tone and these 3 different shades, and they get to look at them. All right, I like that color. I'm like, all right, so now we pick the color. It's like going and picking paint for your house. You pick the color of paint you want, but now you got to pick the finish, right? And so,
I want a nice matte white.
You want matte or do you want glossy?
No, I want glossy, but
so let's say we pick the color. And our colors are shaded OM1, OM2, and OM3. Those are the ones that we pick from. So, all right, so we've got OM2 down. That's the most common. All right, so do we want that color to be from the top of the tooth all the way to the bottom of the tooth? To have it like what we call monochromatic, or one color from top to bottom? Or do we want the way a natural tooth is colored? It has a more warmer tone at the top of the tooth, and then it goes all the way. Yeah, see at the very bottom. You got good looking teeth though, man. You don't grind enough. You must not be. You must not be working enough.
I bite my cheeks too much.
I do too. I got those. What do you call that? You know,
I get callus almost.
or passio buscarum, I think is. I don't ever say that word, but I think I remember that from Path. People chew the insides of their cheek like a little line that goes there.
Yep. I'm very here on both sides.
I developed that in dental school. Stress. It's just so they like we pick like, all right, so we want the colors to be natural and warm and graduate all the way down to the saturation being like 50% of what it is at the top of the tooth. So these are like really detailed. Like I never really saw that. Yeah, I never y'all do that. Like I'm like, well, here's where we are in the conversation. This is where we start talking about the really fine details of how you want to build your smile. But really what I just tell them the easiest thing to do is to go to my Instagram page, find some that you like, screenshot it and send it to me. And then I'll know what you're seeing. And then I'll describe to you like, okay, so the ones that you showed me had these characteristics. Which one do you like here? Is it this that you like in that smile, or is it this that you like in that smile?
So how many people would you say pick a transition in color versus just pick a solid color for the teeth or for the veneers?
So I've really, I have one particular set of photos where I say this is the same color on this before and after as this color, but this one over here is that layered, more natural transition. Okay. This one over here is the monochromatic. This person over here told me that he wants to walk in the room and everybody see his teeth. Yes, he wants the biggest smile in the whole room. And then this person over here, who's she was at the time, she was reigning Miss Ohio International, I believe it was. So she's like all out in pageants and stuff like that, modeling and all. And she wanted nobody to know she had veneers. So when you want that look, you go with the more natural tone. So I have seen a shift in the last probably 2 years of people wanting that big, bold, bright, monochromatic to now it's probably 50%.
Okay.
Probably 10% wanting that natural tone. And now it's probably half. And I think the more that I do natural like that, the more people see it and the more they like that look.
Yeah.
That look. But when people find out that you don't have to drill on teeth, and sometimes we don't have to drill at all, that's when they start thinking, maybe I could do that. Maybe I could do that.
Yeah, I totally thought you had to file them and it was.
My wife forever, we've been married 21 years, and for 20 years, she was telling me her teeth are small. And I thought she had the most beautiful smile. I mean, that's the first thing I saw when I was 20 years old when we met. I was probably 21 years old. And she had the best smile, I thought. And it's just that her teeth were angled inward a little bit. So they were kind of tilted, like the axis of them were tilted inward a little bit. And that's just the way her orthodontist finished. And she was in high school or whatever. And it's not that her teeth were not the right size, it's that they weren't in the right angle. And so all we did with her after we kind of broke it down, we did what's called no drilling, no numbing veneers. So the prepless veneers, actually no drilling on any tooth, no numbing. And that's basically the only way she said she would do it, because she just was so adamant about not like compromising her own teeth. And she was like, well, what happens if I don't like them? Can I just take them off? I'm like, you can take them off, but you're never going to have the same teeth that you had before. Once you put that adhesive on there, it's so strong. Enamel bonds so strong to the porcelain. It's almost like the same stuff.
Okay. That's what I was going to ask you is how likely is it to lose one of those?
It honestly, I have maybe in the past 24 months, I've seen two veneers fall off. It's very rare, and it's always because of an accident. Okay. Somebody bit on or hit a bottle, something like that. And a lot of times the actual tooth underneath it had broken somehow. Okay. It was going to break a tooth anyway. So she did this no preparation. And when she started going out and seeing her friends, people just could not believe it. They're like, what did you do? Did you whiten your teeth? She's like, no, it's fake. You can tell. She likes to tell people,
don't say that.
But they're like, it just looks like your teeth. And that's true, because the no preparation, when you prepare, when you alter the tooth, you're actually building it back. It's going to be different than what it was before. You're doing something to change the shape of the tooth. But when you're doing no preparation, it's really your own teeth enhanced. So I've done a lot of those since she did that. It seems like people really, nobody wants to harm their teeth and do something that's irreparable, that's going to be for the long term detrimental to their their dental health. But what I see most of the time when I'm doing veneers, I'm replacing worn out enamel that's missing, enamel that's been compromised by fillings, been penetrated by decay. Decalcification occurs in enamel because of acidity in our diet. And the enamel is supposed to be the hardest thing in our body, but enamel is only half the strength of the porcelain that we put on with veneers. So when you think of it, if you're taking away something that is 300 megapascals in strength, that's how we measure the strength of material, and you're replacing with something that's 750 megapascals, then you've done something to enhance the strength of the teeth. So as natural enamel wears thin over time, porcelain doesn't do that. Porcelain's really, really strong, and it can actually be, I've seen, enamel is not going to hold up very well against porcelain. And there's different strengths of porcelain. There are porcelains out there that are made that are even stronger than that. But at some point, they start to become detrimental to the teeth that are opposing it. So if you get a tooth in the back that's made of a material called zirconia, it's got to be polished to the smoothest finish ever, or if it's rough at all, it will destroy the bottom tooth.
Okay.
All the time. Where someone has one crown, it's been in there for 10 years, and I look around and there's no wear on any of the teeth, except for the one that opposes that, what we call zirconia crown, because they had to do some grinding on it when they put it in, adjust. And that stuff is so hard that it's really hard to polish to a really fine, smooth, microscopic smooth finish. So it can be detrimental. So you gotta after veneers, you gotta wear protection at nighttime when you sleep. I like to do retainers, like Invisalign retainers for the top and bottom, because teeth can always go crowded too. They can separate, form gaps. They can crowd over time. Teeth are always moving. And if we don't wear a retainer afterwards, it's crowd.
Is that exclusion criteria? Because I can't, because I grind my teeth, and it was recommended that I wear a mouth guard at night. I can't do that. It's not feasible. I spit it out, whatever. Would that exclude me from getting veneers? No,
I don't think so, because I tell people, well, they say, well, how long do they last? And I'm like, well, they're going to last you like your teeth would last you. So if you brush and floss and you go to the dentist every 6 months and you do all the preventative care, you're going to get a lifetime out of your teeth and any dental work. What would make someone want to change the veneers is if their teeth don't look the same in 20 years. And teeth can shift over time and move around each other. And if you don't like the look of that, then that might be a reason to, do something cosmetic to your teeth down the road. So I try to eliminate some of those things that might cause someone to want to replace them. We definitely work on prevention, but wearing a retainer helps. You should try that. If you had that thicker guard on top, right? Is that what you had?
I can't. It was something like that. I mean, it would just work. I would just end up spitting it out every night.
They're big, they're bulky, and a lot of people, they're not very compliant with them. So what I've seen is someone is not doing well with that big, thick acrylic piece in their mouth, like a night guard, then getting a set of Invisalign retainers, which are much thinner, like paper thin, and using one on top and bottom. Not only does it keep the teeth protected and keep the wear rate down, but it also holds both the top and the bottom teeth straight. So I see a lot better compliance with.
That's a good idea.
So knowing if you're clenching and grinding, and if you're having that tension in your jaws, you're biting your cheeks during the day, you're taking 10 Adderalls a day or whatever.
Washing them down with some Monster. Yes.
chewing Adderalls all day long. And, and all the testosterone, right?
Yes, exactly. Yeah.
The recipe for success,
Superhuman.
Right? You run through the brick wall back there.
Yeah. Well, with 3 kids and owning your own business, that's less than you even have to deal with, and you got to keep
a lot. It's a lot. You got to keep up somehow, right? Yeah. So another thing that people a lot of times ask me is, how much does it cost?
Yes, that was one of my questions.
Honestly, what I don't think that you want to ask how much does a veneer cost at your office, as to know how much your case is going to be. It's more about going to someone who has, I feel like, the philosophy of minimally invasive dentistry, because a really good cosmetic dentist can make a dramatic result happen with only 2 veneers, whereas in someone who doesn't do it as often may not see some of those things and say you have to do 6 or 8. But if we do some shaping to the teeth, just polish them up, whiten the teeth, maybe do a little Invisalign, I've saved people thousands of dollars by them coming in saying, well, I want all my 10, they're all crowded and they got spaces. Yeah. They're uneven. I'm like, all right, let's do Invisalign. 3-4 months of Invisalign. Now we come in and we only have to do 4 veneers. So I save them $6,000-$7,000 by doing Invisalign instead of doing all those veneers at once. So it's not as much about how many veneers you do as there's a lot of trickery that goes into making things look really natural and being able to do it with the least amount of actual modification to the tooth. So
tooth color over time, like a normal tooth will, because I drink a lot of coffee, and that's my biggest complaint with my teeth is the color.
Yeah,
it's, they're
teeth are going to absorb
50 shades of yellow and gray.
Yeah, and, teeth are going to absorb it. Enamel absorbs it, but porcelain does not.
Okay,
it has a glaze. Like if you look at porcelain china and it has that clear coat on it, that glaze protects the porcelain from absorbing any what we call extrinsic or external stain. Okay. Enamel is like a wick. And if you douse it with coffee every day or blueberries or tea, that stuff will latch on to the external surface, but bleed into the inner surface of the tooth and become intrinsic.
Also, that's something I'd want to keep up with veneers, and is making sure my natural teeth have the same shade as my veneers.
That's right. So let's say you do 4 veneers in the front and correct some things, but you have your natural teeth behind it and you match them now. In 10 years, your other teeth could turn. So people often ask, well, how do I keep them up? Well, you got to get that little retainer tray and we can do some whitening. That whitening stays good for 10 years, but what about 10 years goes down the road, 10 years, your teeth start to change color. You can always do a little whitening to kind of keep it balanced there a little bit. So it's not that hard, but if you don't want to ever worry about color again, then you want to do more than usually 4 to 6 veneers. You want to do like 8 to 10. Okay. So those cases typically range between $5,000 and $10,000. That's most of them are in that ballpark. Now, if somebody wants to do like top and bottom, that can double the cost on it. So
how often do people do bottoms? Because my teeth overlap.
Probably about 25%.
See my bottom.
It's more about what you show when you smile.
Okay.
When you smile, and you're like, some people show 50-50. Some people show only top teeth. And I say to people all the time, I was like, look at the old guys on the news, and the more gray hairs you see on them, the more lower teeth you see. Yeah. Why is that, Doc? Why is that?
It's probably resorption of the jawbone, I would guess, and laxity of the.
I say it's muscle tone in the upper lip. We our muscle tone lessens over time. So when we smile and we show top teeth now, as our lip gets longer, like Mitch McConnell, right? All those old guys on TV. So a lot of older people will tend to do bottom teeth because their teeth are just that much more stained and much more worn. So I'd say it's probably about 75% of the people just do top. When you're doing more of a rebuild where all the teeth are worn down in size, a lot of times you have to do them all to make sure that they function properly together. So yeah, so that's the list of questions I had. And how do people pay for it? That's another thing that, you all use Care Credit in your office. Do you all use Care Credit's really common in health field, especially in our world. Care Credit's great because you can use it at any pharmacy, veterinary, eye doctor, just about. There's most places out there take Care Credit, and they also give real favorable terms. A lot of times 12 months of interest-free payments. And that's probably what most people do, is finance it with Care Credit. And a lot of times we can get insurance to kick in too. I mean, people often say that cosmetics aren't covered by insurance, but there's a lot of times when if someone is allotted $1,000 for their dental insurance here, that's the most common amount. A lot of times we can get that by using insurance wisely. Now, I wouldn't just write it off and say, "Oh, we don't. You're not going to be able to use your insurance." That's not the case. We have really good insurance people that, the majority of what our office does is insurance type work where, you get your cleaning, your filling, your crown, take a tooth out, and insurance pays for a lot of it. But we can a lot of times use the insurance to your advantage to help out with that. And then also, if you don't have insurance and you're looking for a way to help pay for it, we actually have what's called a membership plan in our office. And a membership plan is different than insurance. It's actually like I liken it to a savings plan at Costco, where you get a reduced. Well, you can't go to Costco without the card. You can come to our office without a membership, but it saves you 15% on all treatments without exclusion. And nothing is whitening's included in that, Invisalign, veneers, things that typically insurance will not cover. It covers a 15% discount on those items. So,
well, I think that's what we're doing, because you're doing my crown.
Yeah,
back here.
You don't have traditional type insurance. That really helps because it pays for your cleanings for the year. You get 2 cleanings and all your diagnostic, like radiographs and exams and things like that. So it promotes someone to come back. I don't want to do dentistry for someone and never see them again. I know that the best value for the patient is going to be over a lifetime of preventative care. We know that someone over the course of their life who comes to the dentist every 6 months has a much, much lower spend over the course of their life than someone who only goes in when something's broken or hurts. Yeah. So
it goes back to that ounce of prevention is worth more than a pound of cure.
Pound of cure. That's a really good quote. I like that one. I actually wrote that one down when you mentioned that earlier, maybe last month or whatever. But that's really, really true. And people ask me all the time, it's like, all right, so this treatment that you're wanting to do is $10,000, and you want to give me a 15% discount if I sign up for free cleanings. And I'm not about that. Like I know that the best value for our practice is a lifetime patient too.
Yeah.
Well, I want what's best for the patient. And I've always taught everybody around me, if you take great care of your patients will take great care of you. Hands down. So that's kind of how we built our practice. And certainly it's minimally invasive. It's driven on technology. And now all of that stuff helps us do things like cosmetics and taking that just to another level. So that's kind of the scoop on veneers. I mean, that's probably what I do the most of anymore is cosmetics, but most cases, honestly, there's veneers, there's crowns, there's implants associated with it. There's a lot of things that come into these plans. And the best thing about our office, I feel like, is there's the ability to be able to do everything under one roof instead of having to go to this doctor for this doctor for this. I had to talk to an orthodontist today. This patient's coming in tomorrow, and he messaged me, and he's trying to finish up with Invisalign. It's been in it for, I don't know, maybe a year or so, and his 2 front teeth had root canals and one of them's broken in half, and he needs to get an implant, and it's like dangling there. And he's just ready to be done with the Invisalign. Everything it's 99% perfect. And he went to the orthodontist today, and they're like, no, you still got to do, I mean, you're never done with ortho, it seems like. And he's like, he's telling me I'm not done yet. I got to get this done, or my tooth's going to fall out. So I called the orthodontist. He's like, well, we just got to, he says he wants to do it right, we got to wait it out. And that's the difficult part when you have different people overseeing the treatment. Who's actually leading the treatment?
Yeah.
It's really the patient. And so we have to listen to our patients more than we talk.
Yeah.
And I like having everything under one roof because I know I can quarterback the plan based upon what's the patient's desire, So that's I think that's a real advantage in our office. People really like the fact that, they can get their wisdom teeth out while they're doing this over here. And we got 4 doctors in our practice, and some specialize in cosmetics, some in implants, some in bonding and root canals, and some in Botox type fillers and stuff that even one of them's getting into now, doing a lot with like TMJ stuff and all that too. So that's kind of what I focus on, is more the cosmetics, but we do everything in our office. So it's nice to work with a team that has, everybody has a niche, I think, for, in our practice. So,
well, you clarified my common, I guess that's the more common misconception that I would think of, is the grinding down of the teeth or filing down of the teeth to put them on. That's how I pictured it.
Every case is different. If like today I had a case that the lady had orthodontics twice and just never could finish it. She, Invisalign is something you actually have to do on your own. You have to wear the things, you have to follow the treatment. And she's really busy. She's always got something going on and gets sidetracked. So I tried Invisalign twice. I just can't get it. I need to get these things done. So in that situation, some of the teeth were over here, some were over here. This one I didn't have to drill on at all. This one I had to drill on quite a bit. This one, not so much. So in that case, there was 8 teeth. I think there were probably 3 teeth that we didn't have to do any drilling at on, some that we had to do more conventional style. So it's every case is a kind of a mixed bag, it seems like. But just knowing that you don't have to do drilling on teeth is really, I think, important for people to know. It's case dependent, and the best way to find out what your situation will be is to get a virtual consult. That's where it all starts. My virtual consult feature on our website, and there's a link in my bio on Instagram. That is the best way to start this process. I feel like you can submit like a smile selfie type of picture.
Yeah, we've done it super easy.
Yeah, I think I talked to my wife about it.
Yeah,
I love it. You can kind of describe what you see in your smile and what kind of goals you have. Send a picture. And what I do is compile like a PowerPoint presentation with lots of different slides explaining things and case examples that pertain to your specific situation. And it's about a 5 to 10 minute video of me just kind of going through the scenarios, talking about how the process works, what you would have to do, how many teeth you might need to do, a range of price. And I think mainly you just get to hear the doctor talk about your smile and to see if that is something that you kind of mesh with. And if it's completely like, oh, I was not thinking that at all, well, you don't have to waste your time to come in.
Yeah.
It's a great way to get a feel for the doctor, the office, the culture, the treatment options that you might have. And then if you like how things sound, then you make the in-person appointment. And those always go much smoother when someone has had a virtual consultation video. Right. And it's not like back and forth like this is. That's what we call a synchronous consult. And you can do that. I don't like it because there's a lot of pressure involved and I don't get to like prep for it. So what we do is called asynchronous, meaning you send the information, I compile it back. And usually within a couple of days, I'm sending that video out, and you can replay it and watch it over again. You can do it with your wife or your husband or whatever, sitting right next to your mom or dad, and hear what they think about it. Because, a lot of times you see these consultations, someone comes in, they're wondering, well, I need to talk to my husband about it. I don't know. And that's good. You should. You shouldn't, go off and spend that kind of money without telling them. But no,
when we do consults, I encourage them to involve their significant other, because it's a big decision. These are big financial decisions. These are big life-changing decisions. And your support structure should be part of that decision making.
Yep. No doubt. It's something they'll always remember. And I want the experience to feel good from the first touch point with that video to the follow-up thank you letter that I'll send them afterwards. I remember these things like details from cases that happened years ago. Because you're so into it, at that time, and you really form a great relationship with the patients after you do cosmetic work, and you're a part of their journey in life, really like setting a different course. I feel like,
yeah,
you almost feel like a piece of you's with them and a piece of them's with you, and you build from that just as well as they do. I feel like as a treating doc, it's really a privilege. I feel like.
So you remember teeth like I remember butts. So a patient will call and have a question about something, and my wife will say, "Oh, so and so called." I'm like, "Oh, I don't know that person." And she'll show me a picture of their butt. I'm like, "Oh yeah, what did they need again?" And you remember everything about them.
Yeah.
You do that with teeth. You're like, "Oh, I remember those teeth."
It is weird like that. So now we have this new thing we're using when people, like, we send them, they make an appointment, they get a link to fill out paperwork, and there's a feature on there where you can take a picture, that links with your account. So when we pull their account up, the face of the picture of their face comes up, right? Like, would you tell them just take a picture of your butt, and when you pull them up on the software, like, just look at butts? But see, you're treating everything. You're treating both ends, bro.
Yeah.
Both ends. My wife, so we had 12-year-old triplets, and we had a really, really like stressful pregnancy with those triplets. And one of the first, I think it was the first doctor visit I think they had an ultrasound. I wasn't even there. It was our third kid. I'm like, another ultrasound. You go by yourself. We got a problem. But so then I'm at the next doctor's appointment, and Dr. I can't remember his name now. I'll never forget his face. He's like, so he's strapping up. He's like snapping on the gloves. So you're a dentist, huh? Oh, I don't know how you do that all day long. I'm like, doctor, you're getting ready to go down. I don't know how you do it down there. Trust me, I'd much rather be up here.
Oh yeah.
So yeah, we never saw him again. He kicked us out. We went to the high risk pregnancy center, and I was like, I'm gonna remember his name. Will come after you one day.
Who did you see at high risk?
It was Tri-State Maternal Fetal at Good Sam. I remember Dr. Brady. There was
Dr. Boss.
No.
Okay.
There were several of them, but I think Brady's the one who ended up delivering.
Okay.
He was her favorite, actually, so we kind of got lucky that way. But there was
a friend of ours is he's like the high risk guy in Cincinnati, and he works for Good Sam. And weirdly enough, it was actually our first pregnancy, they were all worried about the cord. Oh, his cord had something with the vessels, and like, oh, everything was fine, but it's like, well, you got to go see a high risk doctor, and they referred us over, and it happened to be our friend. And
oh, really?
Yeah, it was just funny because I called them. I'm like, hey, we're coming to see you. So
it's probably not a good thing. Everything turned out okay, though.
Was that? Oh yeah. Thankfully, because a lot of times they don't for people, but it's just kind of funny.
Yeah, well, we were really fortunate. We didn't know if one of them was going to survive, so she was hospitalized for 6 weeks before they were in hospital bed rest before they were born, and they were monitoring one really closely because he was just. We were told to plan for 2. And so once he got to 30 weeks, they were like, you know what? If he stresses out, we're going in. We're going to get these babies out. He was projected to be only like a pound. He was 1.3 when he was born.
Wow.
He lost some weight because he had surgery at day 3, 31 weeks, and had a big atresia, I guess, in the gut.
Mm-hmm.
So was like an avascularized piece of his intestine. I guess they had to put him in a colostomy bag. probably a month, maybe weeks. And then they had to reconnect him and then watch him progress and start growing after that. Eating. And it was rough, man. It was rough. We were in there for 7 weeks total with Sarah. And then when she got out, he was in there another 100 days. So we had 2 babies at home. And I swear all that stuff, it just thickens your skin, and nothing bothers me. Nothing really bothers me anymore. People are like, how do you do it? I only have 1. How do you do it with 3? I'm like, I don't know. I don't remember that. We were just like autopilot, you know.
Yeah. Self-preservation mode. You're surviving. Yep. You're just trying to survive.
Yep. So now they're in 7th grade, so they're growing up. But
oh man,
it's fun.
No issues with the intestinal tract. Everything's good.
I can't believe it. They were saying he won't be able to eat this. He'll always have problems. I'm assuming at some point as he grows, he's going to have some scar tissue adhesion type things that move. But he has 0 problems with the number one thing when he was born was his gut. There's been all kinds of other things, but other than it was just he had some urology issues. He had lots of procedures below the belt. He's been a little trooper. He's an inspiration. Keeps me rolling. That's for sure. So yeah, off on tangent. I digress a little bit. So that's veneers. So we've got liposuction in the books. We got veneers in the books. And I saw you the other day do some threading.
Oh yeah, so the threads. Those are pretty wild.
We'll have to hear more about that. We'll have to do something with that.
Well, I need to get some in on you.
I don't get them. I got high cheekbones. I think my great grandmother was Pocahontas, they told me, or something like. I don't know, but nobody believes that. But I got these real prominent cheekbones.
This is what it looks like with no cheeks.
No cheeks.
No cheeks. Have you heard of the OG curve?
No, what's that?
When you're looking at a face on an oblique angle, you want to see a little bit of dip here, a little bit of outward here at the cheekbone, and a little bit of inward again here. And so it's almost this, I guess, sigmoidal curve. And when you look at my face, what do you see? Straight line. No cheeks.
It's a Brad Pitt jawline. What are you talking about?
No cheeks.
No cheeks.
We used to have an employee who would always say, I'm going to give you cheeks. I'm going to give you cheeks.
Yeah.
So luckily I survived. I held out long enough and they have since moved on, so I don't have to worry about it.
Yeah. Good deal. All right. So, another one down. Thanks for paying attention today, guys. And hopefully you learned something here a little bit, and we'll keep that stuff coming.
Well, thanks for educating us on veneers. It actually answered a lot of questions that I had. So
I appreciate it. I appreciate your time. I'll see you soon.
All right, sir. I will talk to you later.